injury prevention. Option B, performance enhancement. Option C, rehabilitation. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 222. The rest ice compression elevation protocol is most efficient for which type of injury? Option A, acute injury. Option B, chronic injury. Option C, overuse injury. Option D, all of the above. And the answer is option A, acute injury. Now let's move to question number 223. Which of the following is not a common mechanism of injury in sports? Option A, overtraining. Option B, sudden deceleration. Option C, direct impact. Option D, poor sleep quality. And the answer is option D, poor sleep quality. Now let's move to question number 224. The eccentric phase of muscle contraction is responsible for option A, muscle lengthening. Option B, muscle shortening. Option C, stabilization. Option D, all of the above. And the answer is option A, muscle lengthening. Now let's move to question number 225. Which of the following is the most important factor in determining return to play timeline for an athlete? Option A, severity of the injury. Option B, athlete's age and fitness level. Option C, type of sport and position. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 226. The functional movement screen is reliable tool for option A, identifying the movement dysfunction. Option B, assessing sports-specific skill performance. Option C, determining an athlete's training readiness. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 227. Cryotherapy should be avoided with patients exhibiting option A, myofascial pain syndrome. Option D, severity of spasticity. Option C, degenerative joint disease. Option D, vasospasm. And answer is option D, vasospasm. Now let's move to question number 228. Which of the following is primary goal for price protection rest ice compression elevation protocol in management of the acute sports injury? Option A, promote tissue healing. Option B, reduce muscle spasm. Option C, improve joint range of motion. Option D, enhance athletic performance. And the answer is option A, promote tissue healing. Now let's move to question number 229. The open kinetic chain exercise is most appropriate for option A, strengthening proximal muscle groups. Option B, improving proprioception. Option C, rehabilitating lower extremity injuries. Option D, all of the above. And the answer is option B, improving proprioception. Now let's move to question number 230. Which of the following is the most common type of sports injury? Option A, sprain. Option B, strain. Option C, contusions. Option D, fractures. And the answer is option A, sprain. Now let's move to question number 231. Which of the following is the primary function of sports taping or bracing in injury management? Option A, provide pain relief. Option B, improve joint stability. Option C, enhance athletic performance. Option D, all of the above. And the answer is option B, improve joint stability. Now let's move to question number 232. Which of the following is the most effective treatment for grade 2 ankle sprain? Option A, RISE protocol. Option B, immediate surgical intervention. Option C, immobilization in a cast. Option D, functional rehabilitation with early weight bearing. And the answer is option D, functional rehabilitation with early weight bearing. Now let's move to question number 233. The Binghamton score is used to assess option A, ligamentous laxity. Option B, muscle flexibility. Option C, joint range of motion. Option D, all of the above. And the answer is option A, ligamentous laxity. Now let's move to question number 234. Which of the following is the most important factor in determining the success of sports injuries rehabilitation plan? Option A, adherence to the prescribed exercise. Option B, frequency of physiotherapy sessions. Option C, use of advanced technological mobility. Option D, all of the above. And the answer is option A, adherence to the prescribed exercise. Now let's move to question number 235. Which of the following is the primary role of sports physiotherapist during a competition? Option A, providing on-field emergency care. Option B, developing pre-participation screening protocols. Option C, designing individualized rehabilitation programs. Option D, all of the above. And the answer is option A, providing on-field emergency care. Now let's move to question number 236. Which of the following is the primary objective of an foam rolling or a myofascial release technique in sports rehabilitation? Option A, reducing muscle soreness. Option B, improving joint range of motion. Option C, increasing muscle strength. Option D, enhancing the neuromuscular coordination. And the answer is option B, improving joint range of motion. Now let's move to question number 237. Which of the following is the primary mechanism responsible for the development of medial tibial stress syndrome or shin splints in runners? Option A, excessive pronation. Option B, muscle imbalance. Option C, overtraining. Option D, poor running technique. And the answer is option A, excessive pronation. Now let's move to question number 238. The closed kinetic chain exercise is most appropriate for option A, improving balance and proprioception. Option B, isolating and strengthening specific muscle groups. Option C, enhancing functional movement patterns. Option D, all of the above. And the answer is
option D, all of the above.
Now let's move to question number 239. Which of the following is the most important consideration when designing a sport-specific rehabilitation program for an athlete? Option A, restoring full range of motion. Option B, achieving pre-injury strength levels. Option C, replicating the demands of the sport. Option D, minimizing the risk of re-injury. And the answer is option C, replicating the demands of the sport. Now let's move to question number 240. Which of the following is the most common mechanism of injury in overhead sports such as baseball and tennis? Option A, sudden deceleration. Option B, repeated microtrauma. Option C, direct impact. Option D, ligamentous laxity. And the answer is option B,